Roaming around, always looking down at all I see. Painted faces fill the places I can't reach. You know that I could use somebody. You know that I could use somebody. Someone like you.
When a person doesn't think normally, whatever normal is, when they're outside the box or they've had some loss.
Usually when you have to anticipate somebody's needs because they stop realizing that they have them.
Well, dementia is a issue with the brain and the way that the brain fires and connects, and it actually atrophies. It's an atrophying process of the brain. And there's many different stages of dementia. There's different stages, and people do different things depending on what stage they're in. They normally have long-term memory intact, but it's most of the time the effects on the short term. So they may be able to tell you things like their name, their date of birth, their address, if they've been living there for a period of time, like, you know. But if you're going in there and you're telling them something right now, you may come back in 2 minutes and they might not remember what you told them.
Or short-term memory, they cannot remember what they have for lunch, but they can tell me their entire family history for the past 75 years.
You can't sit them down in front of a movie. They're there maybe through the credits and they're bored, they're doing something else.
If you stay on a task for too long, you lose them quickly. So unless it has their full undivided attention, you might get 5-10 minutes. After that, you're really pushing it. And it has to be something that they like. If it's not something they like, they don't stay with it. They quickly lose interest and don't pay attention at all.
They can be easily distracted. Their attention span is very short to tasks sometimes when they're in the middle to end stage, of course, coming into the end stage. So you constantly have to be redirecting them back to the task.
Dementia patients do what feels good to them. So if they're hot, they'll take off their clothes. If they're cold, they'll layer inappropriately. But mostly whatever feels good is what they tend to do.
When they get to the later stages, some of them are exit seeking. They'll be even at home trying to get out, or they've gotten out. That might be where they search their family for a long-term care facility because it's no longer safe at the house for them.
Primarily safety awareness. For us, it's them getting up out of bed without requesting assistance, not using the call light, not waiting for someone to help them out of the bathroom. So within the healthcare facility, it exhibits itself more that way. How they exhibit dementia, the behaviors they have, the agitation they have. Some residents become very behaviorally involved and very agitated and mean and strike out. Others become very withdrawn.
Well, if their first language is Spanish, they generally go back to Spanish.
Mm-hmm.
And they'll understand you, but they'll answer you in Spanish or whatever the language is. So it's hard on the caregiver because I don't speak Spanish or German or Polish or whatever. And so you have to get an interpreter.
Mm-hmm.
And depending on the interpreter, is it really what the patient's saying? It's hard. But you can do a lot with motions and eye contact. And some of these people have either forgotten or they're so far gone that they only have a limited vocabulary left.
We have a particular man who never spoke Spanish, and he's Spanish. And I would always speak to him in Spanish when he got irritated, and he would always answer me in English. As his dementia has increased, even if you ask him in English, he'll answer in Spanish. I believe it's his primary language because, I mean, he does have an accent, but his wife was American. So, I mean, over 30 years, English was pretty primary at home. But I think as dementia has progressed, he's reverted.
And sometimes they have word retrieval problems, like when they're trying to tell you something, they take a little bit of extra time trying to explain what it is they're wanting.
Depending on the patient, yeah, a lot of them are able to talk, but not necessarily anything that makes sense. There are those that are severely impaired. Those individuals in the end stage of dementia may not be able to communicate at all.
Well, I'm better at meeting people where they are, not trying to bring them to me.
Greatly increased my empathy. I love working with the dementia patients. Definitely improved my patience in dealing with people overall.
You want to give them one, like, command at a time. Tie your shoe. Not tie your shoe, put your shirt on, button your shirt, you know, one thing at a time. And don't expect them to know even what you're talking about. Help them, but let them do as much as they can.
Study, learn the symptoms, find alternate ways of treating them, take your time, and be patient.
With the dementia patient, we don't use the reality orientation and trying to bring them back to reality. We go wherever they are. You know, so if they're back in 1922 at a ball game, I go to 1922 at the ball game with them. And what a great thing. They're happy, they're laughing, they think we're at the ball game, and that's a great place to be. As a caregiver, if you go there with them versus trying to fight with them and bring them back to where you are, it's very rewarding.